This metronidazole is a group B in FDA classification. So it is safe in pregnancy as well as breastfeeding. Actually, the first and second trimester, the patients are easy to treat because they can recline on the dental chair more easily. The problem comes to the third trimester. Is coming to a dental procedure. First and the foremost thing the dental doctor has to do is tell the patient to urinate. Because of the overactive bladder, the patient will have a tendency to. Other alternatives include tramadol and ibuprofen and aspirin can be given, but not in the third trimester because of the chances of closure of patent ductus arteriosus.
Most of the dentists, they prescribe Amox as well as the paracetamol, considering this as the safest drug. So doctor, is there any alternative apart from these two?
In dentistry, the dentist prescribe antibiotics. So first and the foremost thing before prescribing antibiotics is that we have to see the nature and the seriousness of the infection. We have to see the immune status of the patient. We have to see the probable side effect and any allergy related to the antibiotics or the drugs. And always means there should be a judicious way of prescribing these medicines, and it should be a narrow spectrum, and it should be of correct dosage, and it should be of proper duration. That's very important while prescribing an antibiotics. So the safest, as you told, it's like amoxicillin. So in a pregnant lady, it is safest. It can be given as 500 mg TID. Other alternatives include a combination of amoxicillin with clavulanate, that is extended spectrum penicillin plus beta lactamase inhibitor. So it can be given as 625 mg BD. Other alternatives include ampicillin, that is 500 mg QID, azithromycin 500 mg OD. If the patients are allergic to this penicillin group of drugs, we can switch over to clindamycin, which can be given as 300 mg BD. Other alternative is cephalosporin, out of which the safest is cefixime, which can be given as 200 mg BD. And if there is a severe infection, it can be a cefuroxime acetyl to be given, also can be given as 500 mg BD. Coming to the painkiller, the most safest is acetaminophen. As I told, it's paracetamol. Other alternatives include tramadol and ibuprofen and aspirin can be given, but not in the third trimester because of the chances of closure of patent ductus arteriosus.
When it comes in providing metronidazole, there are conflicting reports. Some articles, they suggest giving the metronidazole, whereas some articles, they restrain or refrain giving the metronidazole. So what is your perspective regarding the metronidazole?
As you all know, metronidazole is an anti-amoebic, anti-protozoal drug having a cidal activity. That is, they are bactericidal against anaerobic and microaerophilic organism. So this metronidazole is a group B in FDA classification. So it is safe in pregnancy as well as breastfeeding mother because there is no studies indicating any teratogenicity, fetal toxicity or fetal harm. So it's completely safe to prescribe in pregnancy and breastfeeding moms. And always this metronidazole should not be given as a monotherapy. It should be combined with other drugs like amoxicillin or augmentin for a better bactericidal property.
So doctor, which is the most comfortable position for a pregnant patient to sit on a dental chair, and what should be the maximum duration for a pregnant patient on a dental chair?
Actually, the first and second trimester, the patients are easy to treat because they can recline on the dental chair more easily. The problem comes to the third trimester. So we have to see the comfort of the patient. So first and the foremost thing is reduce the chair time maximum to 15 to 20 minutes. So, and in third trimester, the dental chair should be more upright with the patient in little bit on the left lateral position. As we told, because of the probable chances of supine hypotension syndrome. Then just keeping a soft pillow under the right hip so that there will be no supine hypotension syndrome.
So when can the dental treatment resume after delivery?
Actually, immediately after delivery, she can resume, and depending upon the comfort zone of the patient. Like for a cesarean patient, it can be like up to like 7 days or 10 days. And for a normal delivery, it will be the next days also. So immediately after delivery, like after you have a baby, you can go for a dental procedure because Dental procedures or dental materials will not have any impact on the breastfeeding mothers and any impact on the breast milk.
So, doctor, is it safe to administer local anesthesia with adrenaline during this phase?
At present, lidocaine 2% with 1:2 lakh epinephrine is the anesthetic agent of choice which best balances the efficacy and safety in pregnant ladies.
So, doctor, from the patient perspective, how can the patient prepare before visiting the dental clinic?
Whenever a pregnant patient is coming to a dental procedure, first and the foremost thing the dental doctor has to do is tell the patient to urinate. Because of the overactive bladder, the patient will have a tendency to urinate more frequently. So before any procedure during any trimester of pregnancy, first the patient urinate. Second thing is in case of first trimester, there are chances of morning sickness. There is high tendency of nausea and vomiting. So in such patient, schedule the appointment to the afternoon. See, if at all in the afternoon session the patient is having vomiting, you can switch over to IV, that is parenteral antiemetics. In first trimester, injection perineum is relatively safe. We can give 10 milligrams slow IV. And we can tell the patient to bring soft pillow, and they can play soothing music. And whenever they feel apprehensive or anxious, they can tell the dentist to stop the procedure for a while. And the patient should never be cross-legged in a dental chair. And they can frequently change their position. And during a dental procedure, never go to the dentist with an empty stomach and after a heavy meal.
In dental industry, most of them are females and they too get pregnant. So what precautions should they take care while handling the dental clinic?
So pregnancy is a happy journey. So if you are comfortable, you can work for hours together, no problem. But you have to take care of yourself. Even as a professional, particularly, you should take care of yourself. Hydration is the most important part. At least 2.5 to 3 liters of water is a mandatory thing. How much busy you are, you have to drink a lot of water, because the chances of urinary tract infection, discharge PV, everything is very common in pregnancy, particularly in the first and the third trimester. So hydrating yourself with nearly 2.5 to 3 liters of water. Second thing is the food part. Don't eat stomach full, like heavy breakfast, lunch or dinner. Have small frequent meals, like every 2 hours you have to eat something. Either it be a fruit, either it be like a small idli or dosa, that's enough. But small frequent meals are mandatory. So apart from like thirds of full meal, it should be like 5 small frequent meals should be there. And in a dental practice, there will be long sessions of root canal. It will be like going up to 45 to 1 hour, and it will be straining for a pregnant lady, particularly in the second and third trimesters. So they will have a chance, they will have a long back pain, everything. So they can take a break of 5 to 10 minutes for a long, and just avoid this long procedure. If at all you are doing a long procedure, take breaks in between. That's very important part. Coming to the dental x-rays, the amount of radiation is very less. So actually the dental x-rays are safe, but most of the dentists, even though they know everything, they will be more anxious, particularly in their pregnancy. For that they can wear a lead apron, so that it will protect their baby from the radiation exposure, if at all something exposure is there. Next common problem faced by the working woman is the back pain. All the pregnant ladies, not only the working woman. So back pain usually happens. What happens in back pain is that the uterus, the gravid uterus with the baby, is supported by rope-like things that are called the ligaments. These ligaments is attached to the spinal cord, that is the backbone. It is attached to both areas, that is the inguinal area and to the vagina. So when the gravid uterus becomes an abdominal organ, this ligaments stretches up. It's like a ribbon. And during the second pregnancy, what happens is this stretched ligament will be loose like that. It completely loses elasticity. So second pregnancy, this loose ligament stretches furthermore. So the chances of back pain increases with each pregnancy. So the back pain is very common in pregnant ladies, so that you have to take care. So when you are doing a procedure for a longer time in a dental chair, so you are prone for more back pain, particularly in your second or third pregnancies. So take rest in between. of long procedures.
So thank you so much, doctor, for sharing your knowledge to our viewers.
Thank you, Dr. Prince, for giving me the opportunity. And I think this interview will be an eye opener to most of the pregnant ladies because they're apprehensive to take dental treatment. So I am emphasizing that dental treatment is safe during any trimester of pregnancy, and oral health is as important as other health issues in pregnancy.
So the session for today is completed, and I hope you have gained ample amount of knowledge regarding the topic. If you still have doubts, please feel free to contact us, and please do show your support by sharing, liking and subscribing to our channel. So this is Dr. Prince signing off. See you in the next episode. Thank you.